Hi, my name is Brian Soluseño Quije, and today I'm going to talk about liraglutide in children and adolescents with type 2 diabetes. That it is uh, a type of treatment for type 2 diabetes. Okay, first we're going to talk about the definition. Liraglutide is an injectable subcutaneous agonist, and it is the first non-insulin medication specifically approved to treat young people with type 2 diabetes since the use of metformin was detected.
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating type 2 diabetes. Some people can manage it by healthier eating, being more active and losing weight. Eventually, most people will need medication to bring their blood glucose down to a safe level. Whatever the treatment, everyone with type 2 diabetes needs to learn how to live with it. We help people do exactly that. Take a look at our website to see how we can help you. Our researchers are also investigating ways to put type 2 diabetes into remission, so people's blood glucose levels return to normal and stay there. And they're finding out more and more about type 2 diabetes, so that we can do more to prevent it, find new ways to treat it, and one day find a cure.
Now, issue applied in Ecuador. 10% of people who use it in Ecuador have suffered from pancreatitis and gallbladder disease.
Understanding type 2 diabetes. Type 2 diabetes is a condition where your blood sugar levels, otherwise known as glucose levels, are too high. This occurs when your body cannot use the glucose you get from food. In healthy people, the pancreas releases a hormone called insulin when we eat. Insulin switches on the cells around your body to absorb glucose and use it as fuel for energy. But for people with type 2 diabetes, the body does not respond to insulin. As a result, glucose builds up in the blood. This can damage the arteries which supply blood, oxygen, and nutrients to your organs. Damaged artery walls make it easier for fatty deposits to build up. This can limit the circulation of blood and oxygen, and make it 2 to 3 times more likely for you to have a heart attack, stroke, or develop vascular dementia. The BHF is funding research into how diabetes increases your risk of heart and circulatory diseases, and discover new treatments to counteract the risks. Potential symptoms of diabetes include being more thirsty and more tired than usual, and having blurred vision. However, some people may not have any symptoms and don't know that they have diabetes. We still don't know why some people get type 2 diabetes and some don't. But we do know you're more likely to have diabetes if you are overweight, especially if you are carrying a lot of weight around the middle. Improving your diet and doing 20 to 30 minutes of exercise a day can help reduce the risk of developing complications related to type 2 diabetes. Cut down on sugar and saturated fat. Avoid large food portions and eat more fruit and vegetables. If you smoke, it's time to quit. Take control of your type 2 diabetes. For more information, visit bhf.org.uk/diabetes.
Pros and cons. Pros, it acts by helping the pancreas release the proper amount of insulin when blood sugar levels are high, and it helps to lose weight. And cons, produce severe headache and difficulty to urinating or burning.
Welcome to Your Health with Joan London, presented by the Centers for Disease Control and Prevention.
Hi, I'm Joan London. Diabetes is an epidemic that is sweeping our country, and sadly, it's not just affecting adults, it's also affecting our children. We are pleased to be joined by Dr. Ann Albright, Director of the CDC's Division of Diabetes Translation, who is here to shed some light on this really alarming subject. How serious is this?
Well, type 1 diabetes is still the most common form in youth, but we're seeing an alarming growth in the number of kids with type 2 diabetes. It's certainly related to the rise in obesity. Unfortunately,
childhood diabetes. Type 2 diabetes was once known as adult onset because it was so rare in kids. Not anymore. With 1 in 5 school-aged children considered obese, the rate of type 2 diabetes in young people is climbing. The newest study shows an almost 5% jump over a decade for those between the ages of 10 and 19. Some experts warn the number is still rising. Our Dr. Tara Narula is here with the dangers of the disease at every age. Doctor, good morning.
Good morning.
Why are we seeing such a sharp rise?
This is not something we talked about 20 years ago, and it is heartbreaking to think that now in this country there are about 20,000 children who have type 2 diabetes, 5,000 new cases a year. And this is a disease that is going to take a physical, emotional, and economic toll on these individuals. So how did we get here? One of the biggest risk factors is obesity. We have an obesity epidemic. In addition